Death begins in the legs after 65, 3 hidden warning signs and how to stop it. Most people think the first signs of serious health decline appear in the chest or the head. But in reality, for many older adults, the earliest warnings come from somewhere else, your legs. Your legs are more than just a way to move around. They are a powerful network of muscles, blood vessels, and nerves that keep you active and independent. When something starts to go wrong in your lower limbs, it can be an early predictor of severe illness, even a shortened lifespan. Today, we're going to lift the veil on 3 hidden but critical warning signs that appear in your legs and can predict an early death if ignored. You'll learn how to recognize them, what they really mean for your health, and most importantly, what you can do to prevent a tragedy. Warning sign 1: persistent swelling in the ankles or legs. Let's start with a story. Howard was a retired engineer who loved his active life. Morning walks, weekend gardening, these were his way of staying healthy. Then, little by little, he began to notice that his ankles were swollen by evening. He assumed it was just age. He also had occasional cramps when climbing stairs but brushed them off as normal. No one, not his doctor, not his friends, warned him that these changes could signal something serious. One day, while visiting his grandchildren, Howard collapsed in the driveway. A massive blood clot had broken loose from a vein in his leg and traveled to his lung, causing a pulmonary embolism. The cost to his health, and to his family, was devastating. All because the early signs were overlooked. Why swelling is dangerous. Constant swelling in the ankles or calves, especially if it remains after periods of rest, is not just a cosmetic issue. If your shoes feel tight by evening, or worse, you wake up with swollen legs in the morning, it may indicate that your heart is struggling to pump blood effectively from your lower limbs back to your upper body. Experts from Johns Hopkins Medicine note that chronic swelling can be an early sign of heart failure. This is a condition where the heart's pumping ability weakens, leading to fluid buildup in the body. In fact, a 10-year study published in the American Heart Journal found that older adults with chronic leg swelling had a 57% higher all-cause mortality rate than those without it. A simple test you can do at home. Press your thumb firmly on the front of your ankle for 3 seconds, then release. If an indentation remains, this is called pitting edema and is a possible red flag. If you notice persistent swelling, do not wait. See a healthcare provider promptly. Early diagnosis and treatment can extend life by years. Warning sign 2: changes in skin color or temperature. Nancy, age 73, first noticed her ankles swelling after her weekly bridge games. She thought she was just sitting too long. She bought looser socks and shoes to accommodate the swelling. 3 months later, she was rushed to the hospital with acute shortness of breath. Her cardiologist explained that her leg swelling was the earliest sign of decompensated heart failure, and by the time symptoms worsen, the average life expectancy is only 5 years without treatment. But swelling isn't the only silent sign. Skin and temperature changes to watch for. Unhealthy paleness. A bluish or purplish tint. Unusual redness, like a fireplace glow. Patches of skin that feel noticeably colder than surrounding areas. These subtle changes can indicate peripheral artery disease, PAD, a narrowing of the arteries that supply blood to the legs. PAD is far from harmless. Research from the Mayo Clinic shows it can quadruple the risk of stroke or heart attack within just 5 years. Without proper treatment, PAD can progress to tissue death, gangrene, and even amputation. The story of Gerald. Gerald, a 69-year-old retired accountant, noticed a small pale spot on his right calf. It felt cold to the touch. His doctor told him it was nothing serious, likely just poor circulation from sitting too much. Gerald went on with his life. 4 months later, the pale spot had grown, and even short walks brought intense pain. A second opinion revealed 3 severe blockages in his leg arteries. What to do if you notice these changes? If you see unexplained color changes or feel temperature differences in your legs or feet, take them seriously. Seek a vascular specialist immediately. Begin circulation-boosting exercises such as ankle circles, seated leg extensions, and gentle foot flexes. A University of Michigan study found that doing simple leg movements daily increased blood flow to the legs by 35% in just 2 weeks. Warning sign 3, pain while walking, claudication. Evelyn, a 71-year-old retired teacher, felt occasional pain in her legs while walking to her granddaughter's birthday party. She ignored it, until she suffered a major stroke that partially paralyzed her right side. Her neurologist explained that this type of leg pain, known as claudication, often signals severe artery blockages, not just in the legs, but also in the arteries that supply the brain. Why this pain is so dangerous? According to the American Heart Association, intermittent claudication can triple the risk of deadly strokes within just 4 years. Data published in the New England Journal of Medicine also shows that this symptom can shorten life expectancy by up to 10 years compared to those without it. This pain is essentially a cry from your muscles. They are starving for oxygen because blood flow is restricted. How to fight back? Vascular surgeons at Stanford Medical Center recommend a 7-minute walking protocol. Walk until you feel pain, even if it's only 30 seconds. Rest until the discomfort disappears. Repeat for 7 minutes daily. This simple routine can increase leg circulation by 45% in just 6 weeks. 3 foods that help dissolve arterial plaque. Garlic, at least 1 fresh clove per day. Pomegranate juice, about 120 milliliters daily. Walnuts, a handful every morning. A University of Maryland Medical Center study found this combination reduced arterial blockages by 26% in 90 days, without medication or surgery. 1 oil to avoid. Researchers at Harvard Medical School warn that corn oil contains compounds that accelerate plaque buildup in people over 65. Replacing it with extra virgin olive oil can improve arterial flexibility by 31% in just 30 days. Final thoughts, your legs are talking to you. Your legs are more than a means of getting around, they are a mirror of your cardiovascular health. Persistent swelling, unexplained color or temperature changes, and pain while walking are not signs of aging to ignore. Early detection and small daily actions, like circulation exercises, dietary changes, and regular checkups, can add years of active life. If you or a loved one notices any of these 3 warning signs, take action immediately. Don't wait until you're in the hospital. Prevention is always more powerful than emergency treatment. If you found this video helpful, check out my video on how to naturally clean your arteries and boost circulation. You'll find the link on your screen and in the description below. And if you enjoyed this video, feel free to give it a like and subscribe to my channel so you won't miss anything in the future. Thank you.